Hey guys, I get asked this question a lot. Should I strength train if I'm over 40 or 50 years old? And my answer is most definitely yes, you do. Actually, I think it's more important that if you are 40 years old or older, it's more important for you to be lifting weights than it was when you're 20 years old. And it's not for vanity reasons, it's for health reasons. And that's what we're going to discuss today. Now, I'll tell you a little bit about my story is I didn't start lifting weights until I was like 40 years old. Now, I'm 53 right now when I'm recording this video. So, last 13 years, I've been lifting weights. Now, the reason I didn't lift weights until I was 40 may be some of the reasons that you don't lift weights. It could be one, it could be a lack of time. You know, I was busy too, going to school, having a family. Sometimes it's very difficult to get that in, and I understand that. Number two is intimidation. I used to walk in a gym and see people lifting 500 pounds with a deadlift, and I thought, there's no way I could do that. I can't even budge that off the bar. So that kept me from going to the gym. And that leads me probably to the third thing that maybe most of you guys that are listening to this are going through is just a lack of knowledge. You look at it and you think, there's no way I don't want to do a squat. I don't want to do a deadlift because I don't want to hurt myself. And I used to think the same thing. But the problem is, I didn't have anybody there to help me. I didn't have anybody there to help me, guide me, teach me what I want, what I should be doing. And that's what I'm bringing out to you guys is, I do some health online coaching, and one of the parts that we talk about is exercise, and it's trying to get you into the gym to lift weights. And the reason is for these reasons that I think are so important. Number one is sarcopenia. Now, sarcopenia is just a medical term for muscle wasting. Starting about age 30 or so, you start losing your muscle mass. And if you don't do something about it, you're going to continue to lose that muscle mass and your strength. And studies have shown that if you have lower muscle mass or if you have less strength, you're going to live a shorter life. And then also, the end of your life is not going to be as productive, and you're going to have a lot more medical problems. So it's important that you at least maintain your muscle mass, preferably increase your muscle mass. And you may be thinking, there's no way I can increase my muscle mass. And I'm here to tell you that you can do it. When I was 39 years old, I couldn't do a pull-up. Couldn't do a pull-up in grade school, high school. But when I started lifting, and when I was around age 40, I started doing pull-ups, just one at a time. Now I can do 25 pull-ups without any problems. And it's because I was persistent and I was consistent in what I was doing. So it's important that you have these two traits that you're going to continue doing these things. You're going to hit some roadblocks like I did at the beginning, but I would be there if I'm your health coach to help you through that. Now, the other thing that is important to understand too is when you're lifting weights and you're doing resistance training, you're going to increase your mitochondria. You're going to have more energy. Mitochondria are inside the cells of every cell in your body, and they produce ATP, which is what we call what we get the units of energy units of energy. So it's important that we do these weights, and so that we can have muscle mass, we can have more energy, and then also that we feel better. I know I feel a whole lot better lifting weights. Adding muscle, and your waist size decreases if you do it the right way, and that's something I can help coach you with. But the thing that is important is how you feel. You may be an executive. You could be doing talks. You could be getting up in front of people. You may not just like the way you feel, the way your pants feel, and that's something that I think that if you add resistance training to your daily routines, you're going to see the results with that. Now, one thing that we do recommend, but it's not on a daily basis, is cardio. A lot of people think, well, I'm going to go out and start running to lose weight. And I think that's kind of like not the best thing to do for weight loss and for long-term health. Resistance training is the most important thing. So if you're 40 years old and you're thinking about lifting weights and you're not sure what kind of program to do, if you're unclear about those things, that's something that we can help you with. We can help guide you to where you want to go and get the results that you want to get. And we'll be there to hold you accountable. And I think that's an important part of the whole process, is holding you accountable to the process, so that when you feel like giving up, we're going to be there to nudge you along to help you get your results. So go to our website if you guys are interested in talking to us about being your coach. We could help you with this, and then other aspects of your health as well too. So I do look forward to seeing you guys, and reach out anytime, and we'd be happy to have that discussion with you. Have a blessed day.